Hello everyone, I feel extremely honored to have this opportunity to make my presentation here today. My article title is Effect of Exercise on Health-Related Quality of Life in Middle-Aged Korean Women Using Big Data. I am Choi. I wrote this article with Myung-Nam Lee, Sang-Dol Kim. Introduction. Middle-aged women are defined by the complex interaction of environmental and physiological factors, and they may be classified as middle-aged women who connect a stable life process from adulthood to just before the onset of old age. Since the definition of the middle-age class is different for each scholar, it is not easy to distinguish them academically. Middle-aged was defined as a woman between the age of 45 and 64 who showed a tendency toward menopause and aging due to physical decline in all organs and hormonal changes, and was sensitive to physical changes. Introduction. Middle-aged is a physiological transition period for women to experience various physical and mental health problems and various syndromes due to menopause. During that time, middle-aged women face a loss in physiological functioning, aging, and menopause, as well as obesity and body imbalance, owing to an increase in body weight and abdominal fat. In addition, a decrease in bone density in the bone causes osteoporosis and fractures. Hormonal changes due to imbalance of the endocrine system and ataxia of the autonomic nervous system due to mental stress cause symptoms such as fever, sweating, chills, skin sensation, cold hands and feet, palpitation, and headaches. Moreover, weakness, fatigue, dizziness, syncope, etc. appear irregularly, and atrophic cystitis and urinary incontinence due to degenerative changes in the genitourinary system also occur frequently. Following physical health issues, individuals may endure emotional issues such as depression, loneliness, and feeling of failure. Middle-aged women are reported to have higher morbidity than men in inducing health problems due to neglect of healthcare, because low conflicts and various life events are affecting their physiological adaptation ability due to physiological and social law changes. Furthermore, antioxidant enzyme activity and aging are known to be intimately associated, because the rapid loss in antioxidant enzymes with age reduces the ability to respond to free radicals or lipid peroxides, and the organs and cells gradually diminish. Obesity, which is one of the causes of various diseases, is caused by the influence of lack of physical activity or excessive intake and genetic factors. It also refers to a condition in which the body accumulates an excess of fat as a result of an imbalance between the amount of energy used and the amount of energy consumed. This can be addressed by increasing physical activity. Regular exercise is the best way to prevent diseases by preventing an increase in body fat percentage and a decrease in muscle mass in middle-aged, as well as by activating the energy metabolism function of the muscles. Accordingly, interest in the necessity of exercise therapy and specific method is gradually increasing. Despite the scientific and empirical recognition that regular exercise for middle-aged women can improve their health, 63.1% of middle-aged women do not exercise regularly. Among these health promotion activities performed by middle-aged women, the exercise area has the lowest practice rate. Therefore, it is important to identify the factors affecting the quality of life of physical activity in order to increase the practice of physical activity among middle-aged women. Research purpose. The purpose of this study was to analyze the aerobic physical activity and health-related quality of life factors (Int 8) of middle-aged Korean women using secondary data from the 2019 National Health and Nutrition Examination Survey. Through this, the effect of physical activity on health-related quality of life was confirmed. To provide basic data for seeking health-related measures to improve the health and quality of life of middle-aged women. Research design. This study is a cross-sectional descriptive research study to confirm the effect of aerobic physical activity on health-related quality of life (Int 8) in middle-aged women. The data used are secondary data from the National Health and Nutrition Examination Survey conducted by the Korea Centers of Disease Control and Prevention, and the quality of life related to health according to aerobic physical activity was confirmed using the basic data. In order to achieve the purpose of the study, exercise was set as an independent variable, and aerobic physical activity was set for a specific exercise. The dependent variable was set as a quality of life related to health construct, and this concept was composed of the lower A factors. This study was conducted on middle-aged women aged 45 to 64 years in Korea. For the study of the subjects, the questionnaire format, as well as data measuring physical and physiological characteristics, were used. This data was conducted in 2019 by the Korea Centers for Disease Control and Prevention and was remitted to 1,428 middle-aged women among the entire sample. The survey contents of this data are designed and investigated as a health survey, interview survey, examination survey, physical measurement, and nutrition survey. Research tools. The data used in this study is the Korea HRQOL, designed to measure the quality of life related to health. This tool is a Korean health-related quality of life instrument with 8 items. Hint 8. Designed to discriminate against healthy population groups. Hint 8 for L is a measurement tool designed with 8 sub-factors in 4 dimensions, including physical, mental, social, and positive health dimensions. Data collection procedure. The National Health and Nutrition Survey is a survey on health behavior, prevalence of chronic disease, food and nutrition conducted under Article 16 of the National Health Promotion Act and is a statistic designated by the Korean government under Article 17 of the Statistic Act. The survey of this data was conducted in a circular stratified sampling method from January to December 2019. This data was investigated using the health survey method, such as household survey, health interview survey, and health behavior survey, self-reported survey. The examination consisted of physical measurements, physiological characteristics change, this to measurement and examination. Nutritional surveys are survey data that consist of the status of eating habits and the content of food intake. Data analysis method. The data collected conducted in this study were tested to confirm the relationship between demographic characteristics, health status, health behavior, physical variables, presence or absence of aerobic physical activity. To verify the causal relationship between the presence or absence of aerobic physical activity and the 8 subfactors of the Korean HRQOL hint 84L multiple regression was performed. The statistical program used in this study was SPSS21.0 version. Conclusion. In this study, the factor affecting aerobic physical activity and quality of life related to health of middle-aged women were identified through hint 8. Aerobic physical activity as a characteristic and quality of life of the subjects was found to be related to age, stair climbing, vitality, work, sleep, and happiness. The subject's physical activity showed a correlation with stair climbing, vitality, and happiness. Stair climbing was correlated with pain, vitality, work, depression, memory, sleep, and happiness. Stair climbing had a positive effect on physical activity, education level, and grip strength, and had a negative effect on age. Pain had a positive effect on education level and grip strength, and had a negative effect on age. Vitality had a positive effect on physical activity, monthly household income, and grip strength. Working had a positive effect on education level, monthly household income, and grip strength, and had a negative effect on age. Depression had a positive effect on monthly household income. Memory and sleep had a positive effect on education level and negative effect on age. Happiness had a positive effect on physical activity and monthly household income. In this study, physical activity was found to have an effect on various life activities. The proposal is as follows. First, because there have not been enough previous studies on middle-aged women, numerous follow-up studies with different factors should be undertaken. Second, while it was designed for middle-aged women, numerous studies on middle-aged males should be undertaken in the future. Third, while this study employed the questionnaire method, it is believed that future research should include a variety of research methodologies, including qualitative research method. Thank you for listening my presentation.